To assess for intrinsic tightness, you want to first understand the anatomy. The intrinsics include the lumbricals that originate off the FDP tendon and also the interossei that originate off the shafts of the metacarpals. So if we look at this index finger, you've got fibers from both the lumbricals and the lateral bands that are crossing the MP joint, and they're sitting volar to the joint axis. So at the level of the MP joint, these tendons are acting as flexors. As we continue into the digit as lateral bands, you can see that they're passing dorsal to both IP joints, so they act as extensors for the IP joints. To assess for tightness, this is a passive assessment. So we want to create a composite stretch on the intrinsics to see if there's restriction in motion. If we know that at the MP joint we're sitting volar, we know that extension is going to put stretch on the intrinsics at that level, but it's going to be IP flexion that creates stretch to the lateral bands distally. So a full composite stretch is MP extension, IP flexion. This can also be used as the exercise to increase flexibility. As of an objective assessment, you can assess the amount of PIP flexion when the MPs are flexed compared to when the MPs are extended. And with intrinsic tightness, you're going to see less flexion of the PIP joint with MPs extended.